The opinions and statements expressed in the following program do not necessarily reflect those of WWDB, its staff, or management.
Good day, everyone. Welcome again to another edition of Boomer Generation Radio. This is your host, Richard Address, coming to you from the beautiful studios of WWDB AM 860 here in Greater Philadelphia and streaming live on WWDBAM.com. This portion of Boomer Generation Radio is brought to you by Kendal, a system of not-for-profit communities and services located in 8 states in the Northeast, Mid-Atlantic, and near Midwest regions of the United States. Kendal advocates for and empowers older adults to reach their full potential and is committed to working with others to together transform the experience of aging. And to learn more about Kendal, which is Kendal, visit kendal.org or call them toll-free at 888-759-0128. That's 888-759-0128. And hopefully on our call-in line is Dr. Tim Johnston, the Manager of Education and Training for the National Resource Center on LGBT Aging. Dr. Johnston, are you there?
I am here.
Hey, I'm always amazed that technology works. Thank you, Tim and Tony, for pushing the right button.
No, thank you very much for having me.
It's good to talk with you. You're in New York?
That is correct.
Okay, and the National Resource Center on LGBT Aging. First of all, let's deal with that. What is that?
So the National Resource Center on LGBT Aging is the country's first and only technical assistance resource center that's aimed at improving the lives of LGBT older adults. So
one of the reasons that I wanted to start talking about this issue, and we have somebody else coming on in June as well to talk about some of these LGBT issues. From your experience, Dr. Johnston, are there different requirements? Are there different challenges? Are there different issues as the LGBT population grows from the non-LGBT population? I mean, we've had this whole revolution of awareness and acceptance and inclusion in the last 10, 15 years. But my sense is that the aging issue is one that still hasn't been really talked about too much. And what I'm interested in your experience in some of these perceptions.
No, I think that is absolutely correct. And when you think about some of the kind of seismic shifts that are happening in LGBT rights and acceptance, they've all been fairly recent. So when we're working with LGBT older adults, some of the things that we need to be aware of or be concerned about is that the history of being closeted and the history of living a lot of your life in an environment that's very hostile to LGBT people puts LGBT older adults in a very different mindset than some younger LGBT people. And it can make them much more reticent and much more fearful to interact with mainstream aging service providers. So, for example, we know that LGBT older adults are much less likely to go to the doctor to seek out preventative care. So we know 17% of heterosexual people delay going to the doctor, but that number is 29% for lesbian, gay, and bisexual people. And a lot of time that's because they're very fearful about accessing these services for fear of discrimination.
Still? I mean, I guess maybe a naive question, but there's still this fear and concern about, disclosing, or, walk me through that. What's behind that? Is it just the historical cultural thing in America?
I think that's right. LGBT older adults spent much of their life fearing discrimination. So if you think about it, until 1973, homosexuality was considered to be a psychological disorder, and you risked losing your job, your family, or your home if your doctor or somebody else discovered that you had same-sex attraction. Mm-hmm. So older adults have lived a lot more of their lives with this kind of fear and are much more kind of acclimated to staying in the closet. So when they enter into a circumstance where we all feel vulnerable, everybody feels vulnerable in the hospital or going to the doctor, sometimes they might feel that it's easier to go back into the closet rather than put themselves out there when interacting with a doctor or aging institution.
So your work in your organization, how do you advocate for this population? What do you do to sort of like continue to break down these barriers?
So a lot of what we focus on at the National Resource Center and a lot of what I do has to do with training and education. So if you go to our website, which is lgbtagingcenter.org, we collect a lot of information, a lot of research and best practices around LGBT aging. The one thing that we focus on is getting those resources into the hands of providers. But a huge component of what we do are training. So I, for instance, will go into an organization and lead them through some basic LGBT cultural competency, and then also do a series of activities that are meant to help them understand the mindset of an LGBT older adult and some positive changes that these organizations can make to create a welcoming and affirming environment.
So when you say organization, I'm sorry, go ahead.
No, please.
So if you say organizations, to put it basic, would you go out and do one of these trainings to, let's say, the Shady Acres Nursing Home or Assisted Living Facility?
Absolutely. So we have two tracks of trainings. One track of our trainings is for LGBT organizations to help make them inclusive of older adults. So, for example, I could go to an LGBT center and help make sure that their programming isn't just skewed to a younger demographic and help them come up with intergenerational activities. Another thing that we do is that we'll go into aging services, so nursing homes, nonprofits that work with older adults, hospitals, hospice care, organizations like that, and help give them the expertise around LGBT cultural competency. So it's an issue that the National Resource Center is approaching from both angles to make sure that LGBT older adults aren't being left out of both of these different resource groups.
So we had here a couple of weeks ago a gentleman who works in outreach and public relations for the Philadelphia Corporation on Aging, which is basically the area agency on aging for Philadelphia County.
Sure.
So if they wanted to do a training for their staff or a consciousness awareness program, they would call you and you would come down to deal with. So you would deal with the various area agencies on aging around the country?
That's correct. So we have a network of certified NRC trainers all over the country. Uh-huh. We also provide webinars and other distance learning to try to catch people that might be geographically far away from one of our trainers. But yes, people can either contact me directly or go to our website, which again was lgbtagingcenter.org, and there you can request a training or more information.
So you just mentioned before, Dr. Johnston, and we're speaking with Dr. Tim Johnston, the Manager of Education and Training for the National Resource Center on LGBT Aging. You just mentioned before that you will do work with LGBT organizations to make sure that they're aware of this, the phenomenon of aging. So I'd like to explore that a little bit. In your experience around the United States, do you find a lot of the organizations and groups that have focused on awareness and advocacy and public relations, et cetera, for the LGBT community, that they sort of like ignored their own aging population?
That's an excellent question. I wouldn't characterize it as ignoring them, but one thing that happens is that a lot of times when people come out of the closet as LGBT, they lose contact with their family. Mm-hmm. They might be kicked out of their family or they grow increasingly distant from them. And if you think about it, in our society, a lot of our intergenerational contact comes through our family. We have grandparents and we have our parents and we know their friends. That's how we make a lot of those connections. So in the LGBT community, if you are no longer in touch with or supported by your biological family, a lot of people form what we call families of choice.
Right.
So these are people who are often very close to you in age who come to be your family. So here we think of my favorite television show, The Golden Girls. That is an example of a family of choice. So within the LGBT community, a lot more of your connections and your support are going to be coming from people in your same age cohort, and there are often less opportunities to have that kind of intergenerational contact. So the way that these organizations have become developed kind of reflects that. And we are helping organizations catch up with being inclusive in terms of age and not just doing programming that reflects the age level of the people who are running these organizations.
I would imagine that the end-of-life discussions and the end-of-life issues could be very traumatic and just difficult to deal with in the work that you do. Someone who knows that they're perhaps in hospice care and approaching the end of their life, who has been separated from their families for perhaps years. And this yearning or this desire to reconnect or to make peace or to have a conversation about the what ifs and et cetera, et cetera. Do you get involved with this at all? Have you experienced this? I would imagine that you have in some way, shape, or form, given just what you've been talking about.
Absolutely. And two things I would like to highlight, especially when we're talking about end-of-life care, or even if we're doing a training in a hospice care or palliative care environment. A lot of times during the end of life, people might come back into contact with family members that they haven't been in touch with. And that can at times be a tense situation, especially if there hasn't ever really been acceptance of the fact that someone's LGBT. But a lot of times at the end of life, people also reconnect with spiritual matters and spiritual issues. And many members of the LGBT community have been estranged from their spiritual communities or their religious communities. And it can be quite beneficial to have people working with them and helping them who are both sensitive to LGBT issues, but also understanding LGBT spirituality and the particular forms that that can take to help people integrate their entire history as they're approaching the end of life.
That raises an interesting question. Through the National Resource Center, do you have clergy like on call who have a specialty in this area, who speak the language and who would be available to someone because who would be, as you would say, needing that sense of spiritual reconnection? Are those people? Do you provide that service?
Sure. So the National Resource Center is housed within an organization in New York City called SAGE,
right,
which stands for Services and Advocacy for GLBT Elders. SAGE offers that form of counseling and also referrals both within New York City and also through its national network, which is known as SageNet. So the National Resource Center, I don't have someone that I would call directly to provide that service, but we are connected within a network of organizations that have a lot of those connections all over the country.
So someone, let's just say, for example, is sitting in Hattiesburg, Mississippi, and is approaching is in hospice care and really feeling estranged. They have that family of choice, but there's this other, as you were pointing out, this other need. They got in contact with you, and through SAGE, they would be able to be connected with a clergy person who would be able to talk with them either in person or electronically or over the phone. Am I understanding that correctly?
Yeah, that is certainly something we would strive for.
Okay.
I couldn't guarantee that, and it would have to deal with the particular connections that we have in that area. But that's precisely the kind of service that we try to provide ourselves. But through our training, we also try to make existing aging networks in these areas and also existing religious support networks more LGBT inclusive. So
you do work with various denominations around the country?
Yeah, we are certainly open to that. And a lot of times when we're doing a training, for instance, at a hospice center, people of different denominations will be, present during that training, or the chaplain at a hospital might come to the training, that kind of thing.
We're speaking with Dr. Tim Johnston here on Boomer Generation Radio, Manager of Education and Training for the National Resource Center on LGBT Aging. And we'll be back with Dr. Johnston in a second, but I just want to remind you that this portion of Boomer Generation Radio is being brought to you by Kendal Outreach, serving the field of aging by raising public awareness and advocacy around important issues of older adults. Through education, training, and implementation of comprehensive approaches to safe, individualized, long-term care practices, Kendal Outreach has been sharing Kendal's approach to quality care with consumers, advocates, providers, government agencies, and related organizations since 1989. And to learn more, visit Kendal.org. That's Kendal.org. And click on the outreach icon. That's Kendal.org. And click on outreach. Welcome you back to Boomer Generation Radio. Coming to you live from the studios of WWDB AM 860 AM here in Philadelphia and streaming live on www.dbam.com. And again, a reminder that if you have a comment, a question, a criticism, a suggestion about the program, email us at boomergenerationradio@gmail.com. That's boomergenerationradio@gmail.com. And we're welcoming back again and thanking again for being with us long distance from far away in New York City. Dr. Tim Johnston, the Manager of Education and Training for the National Resource Center on LGBT Aging. Dr. Johnston, give us the website one more time.
Absolutely. So it's www.lgbtagingcenter.org.
So the explosion in this country right now of continuing care, retirement communities, assisted living communities, etc., is there a concomitant explosion, maybe in quotes, of these types of facilities that are being built specifically for the LGBT community?
That's an excellent question. This is something that we're starting to see, and we think that it's very encouraging. So a new facility is just opening up in Chicago. There are an increasing number of places that are going to be focusing specifically on LGBT aging. Jewish Home Life Care in New York City is an organization SAGE is working very closely with SAGE and the National Resource Center to provide services of this kind. But it's a tiny, tiny drop in an enormous bucket. So while we're excited to see that these types of facilities are opening up, the real work that we're doing is changing existing aging services to be more inclusive and affirming of their LGBT constituents.
So the T of the LGBT is for what?
Transgender.
So let's talk a little bit about this, because this is another segment of the society that's just now getting a little bit more publicity, if I can use that word, awareness, acceptance, inclusion.
Sure.
Walk us through this pathway for someone who is transgendered and as they age. In your experience, I mean, is there even a more of a challenge for identity or reconnection or estrangement, et cetera, et cetera? What's been your experience with this community? And is the transgendered community in what we're talking about different from the gay or lesbian community?
Those are all excellent questions. So let me just back up 1 second and talk a little bit about what makes the term and the identity transgender different from lesbian, gay, bisexual, if you don't mind.
Go for it.
So lesbian, gay, and bisexual all have to do with sexual orientation. Mm-hmm. So the kinds of people that you find yourself drawn to romantically and emotionally. Transgender is about gender identity, which is how you feel about yourself, how your own identity. So the term transgender is meant to point to anyone whose gender identity is different than the sex that they were assigned at birth. So when we think about the sex you're assigned at birth, you can think, whenever anybody finds out you've had a baby, the first question they always ask is it a boy or is it a girl? That's your assigned sex because it's not something that you have any choice or control over. So that's what we're speaking about broadly when we're talking about transgender people. In terms of transgender older adults, we do know that transgender older adults face greater health disparities than the non-transgender population or than the lesbian, gay, and bisexual population, and considerably more discrimination, both within medical agencies but also outside of it. So, for example, about a quarter of transgender people have reported being denied equal health care or being refused health care outright. So this could be, someone refusing to see them, literally refusing to touch a transgender person, or it could be that a transgender person has inordinately long wait times, and it's obvious that this is because of their transgender status.
So they're saying there is this difference in approach, perception, delivery of services, even across the country, and some. Can I use the word tension? Is that a right? It may not be a right. You'll tell me. Even within the LGBT community itself, would that be a misperception?
I wouldn't say that is a misperception. I think that it is the case that transgender people often face greater disparities than lesbian, gay, bisexual people. And there are also some needs and sensitivities that are specific to working with transgender older adults that a lot of people are unaware of.
And do you train? Yeah, go ahead.
Oh, sorry, go ahead.
No, I was going to say, do you train in your training? Do you cover this?
We do, absolutely. So one kind of quick example to give your listeners some context here is that a transgender person might have what we call incongruent documentation. And what we mean by that is that some of their documents might reflect their preferred name and their preferred pronouns, whereas other documents might still have their assigned sex in the gender designation. So that's something that a hospital administrator is going to have to look out for and be aware of. In terms of our own trainings, all of our trainings touch on transgender issues and transgender competency, and we also have a new webinar that is exclusively about best practices for the care of transgender older adults. So it is something that is very much present in all of the NRC's training initiatives.
Oh, that's interesting to know. And give us the website again if somebody wants to get a hold of that webinar or sign up for it or download it or whatever you do to it.
Absolutely. So again, the name of the organization is the National Resource Center on LGBT Aging, and the website is lgbtagingcenter.org.
Let me ask you a question before we start running out of time. In your experience, as the LGBT awareness and inclusion becomes more open and accepted in parts of America, I think we have to be honest with that, parts of the United States. We talk a lot here about baby boomers and the baby boomer generation. Do you deal with baby boomers men and women who their family, their kids go away to college, and all of a sudden they have the children's responsibility, etc., the child rearing responsibility is over, and they come out. They say, I've lived this way, but now I'm really ready to be who I am. And have you dealt with that, or do you deal with that phenomenon, or are you seeing that more and more?
Absolutely. It is not uncommon for someone to come out either as lesbian, gay, bisexual, or transgender after what we call a major life event. So kids moving away to college or the death of a spouse are two times in which we see people coming out. Wow.
And how, the support network for that, I imagine this would be extremely challenging. Someone who's lived a certain life, raised a family, been part of the community, and all of a sudden now makes this, it's different, I guess, when you're 55 or 60 as opposed when you're 17, 18, or 19. Walk me through that if you can.
Absolutely. Coming out is difficult, I think, at any stage of life. And something that we really want people to understand is that coming out is kind of a continual process. So every time I walk into a room with new people in it, I have to decide if I'm going to be open about being a gay man or if I'm going to, feel the situation out more. So it is kind of a major life event that is then something you live with every day of your life. But when you're coming out, let's say you're of the baby boomer generation and you're coming out, you have a lot more life history that is tied up with your heterosexual or non-transgender identity. You have a lot more people who know you in that way and who you now have to be telling your new identity. So I think it can be difficult, and there might also be more kind of reticence or hesitance to hook into existing LGBT communities or organizations.
Really? Why would there be why would that be a greater reticence to tap into that community?
maybe I shouldn't say a greater reticence, but when you start coming out, it's a very new experience, and you're kind of figuring out how to act and how to be and how it is that you want to portray yourself in the world, if you want to make any changes to your gender presentation, that kind of thing. People liken it to a kind of second puberty, and I don't think that that is inaccurate, and it also includes a lot of the anxieties of puberty and a lot of the awkwardness of it. So, it can be a little intimidating to walk into an LGBT space if you've spent a lot of your life denying that aspect of yourself. So while we want everybody to feel comfortable, both LGBT people and non-identified LGBT allies, we want everybody to be comfortable coming into an LGBT space. I think when working with someone who's come out later in life, you need to not expect that they will be immediately as comfortable with their LGBT identity as somebody who's been out for many more years.
Thank you. I would just want to remind everybody before we run out of time that this portion of Boomer Generation Radio has been brought to you by Kendal, a system of not-for-profit communities and services that advocates for and empowers older adults to reach their full potential. Together, we are transforming the experience of aging in Kendal, and to learn more about Kendal, and that's Kendal. Again, we invite you to visit kendal.org or call them toll-free at 888-759-0128. That's 888-759-0128. And we've been talking on Boomer Generation Radio on our Kendal segment with Dr. Tim Johnston, the Manager of Education and Training for the National Resource Center on LGBT Aging. Dr. Johnston, real fast, because we have about 30 seconds, give us that website again. That's very, very important information for people to have.
Yes, so again, we have a number of trainings, both in person and online, available at lgbtagingcenter.org.
Dr. Tim Johnston from the National Resource Center on LGBT Aging. Thank you very, very much. Lots of information, lots of interesting things to think about. Thank you for joining us here on Boomer Generation Radio. And to all of you, have a great week. We'll see you next Tuesday, 10 a.m.